I am Dr. Sheldon D. Fields. I have the high honor and the privilege of being the 14th president of the National Black Nurses Association. That's my volunteer job. I'm also an associate dean for equity and inclusion and a research professor at the Ross and Carol Neese College of Nursing at Penn State University.
You're a leader in so many ways. What experience or moment would you say shaped your leadership style, and how does it influence how you lead today?
One of the most profound opportunities that I had that continues to influence or shape everything that I now do in my nursing career was back in 2009 when I was named a Robert Wood Johnson Health Policy Fellow. I became, at that point, the first male registered nurse to ever be named an RWJ Health Policy Fellow. And I didn't even realize it at the time. And why it was so profound is everything that happens in healthcare is related to a policy issue, whether people understand it, appreciate it, or know it, everything. And once you see something, once you have that lens or that focus, and you bring it to that situation, you really do start to see the world a little different. The director of the time at the program said, at the end of this program, you'll think different, you'll see it different, and she's absolutely right. And I lead with intention. I can see health policy in everything that I do, and the network that comes from being a part of this particular fellowship program, which is the best in the federal government, has had a profound impact on how I lead.
Now, there are many nurses, nursing students who are coming up the ranks. They're experiencing burnout, fatigue, going on strikes, or they're feeling like nursing is not for them.
Yeah.
And it sounds like a lot of what we're experiencing is politics,
Yeah.
health policy.
Yeah.
How do we get early career people to better understand what's going on in that C-suite or in that boardroom so they can better navigate the bedside?
They need to understand that it's all connected, and they even need to understand that it exists. We've done a really horrible job in nursing education of educating these up-and-coming generations about the necessity of being involved in actually enacting your role as an advocate at all levels, and understanding how you fit into the larger system as a member of the largest segment of the healthcare workforce, and the influence that you can have. Now, we have some great examples, you being one of them, about how you can take your platform and have a profound influence, because you are part of a growing number of nurse influencers that wasn't heard of 10 years ago. I mean, this platform has just been phenomenal, and that is just one way. And to understand that once a nurse, always a nurse, and that you have a lifelong obligation to really understand. And then once you get there, once you get into that boardroom, that C-suite, you need to appreciate the cost that it took to get you there, and understand all that you represent. And you also need to reach back, because you also should not be the only one there, especially if you happen to be the first. There should be a second and a third and a fourth, because otherwise you've missed an opportunity.
In the spirit of reaching back, do you feel that enough nurses do reach back?
I think they do, but if you look at the statistics, if you look at the data, the answer would be no. And I'll give you a really great example with one of the speakers here at the conference today, in which she said the least diverse leadership role in the nursing field is that of deans and deanships. So for those nurses of color in particular, who did ascend to deanships, what did you do when you were there? And I say that with a little bit of deference, because I've been a dean of both a College of Nursing and a College of Nursing and Health Sciences. I know what I did when I was there. I know how I reached back, but I also know how that deck was stacked against me when I hit what I will just quite honestly refer to as the white female ceiling. I hit that white female ceiling in nursing as a dean when I was told indirectly or directly that I didn't belong there, or that somehow I got there not on the merits of my own well-being, I got there because of a DEI hire or because, other things that were put in place. And it's simply not true. I never believed that. Nursing, and the beauty of nursing, is that your career can expand in so many different ways and in so many opportunities in the clinical realm, outside the clinical realm, education, research, health policy. The sky's the limit. It's not a limiting career as people tend to think about it.
In order to appreciate that beauty, there's this walk that many people have to experience. Many people have started at the bedside and they leave onto their journey. But we've noticed, and maybe it's more because there's more social media and more influencers who are sharing this. But it seems to be that there are more nurses going on strike or speaking out about work conditions. Some of them feel like they're being punished by their employers. What do you think is going on? Do you think that's always been the case, or we're just seeing more of it now in a social media friendly?
I think we are seeing more of it on the social media, so we're paying attention to it. And then we had a recent sort of couple of incidents that all kind of happened at the same time. So there was a coalescing of some of these events at the same time. And I'm more specifically talking about the recent strike and the simultaneous strike in both California and in New York. And a lot of people think that it's all about money and about pay. That was not the issue. Those nurses, especially the ones in New York, are very clear. We're striking because we're fearful for the care that we're able to provide to our patients. And this is about patient care. It's about our working conditions. It's about being able to come to work in a safe environment and not have to worry about being injured or attacked, and not having administration support us or having legislation in place that if something does happen to me, the person who did it is appropriately prosecuted because there are not good federal laws to protect me. All of that was on the table. It's about the very real working conditions in our healthcare institutions, being understaffed, being underpaid, being made to work in conditions where you cannot live up to your nursing code of ethics to provide the top level of care because you simply do not have the resources. So nurses had to strike in those instances. And, to a certain extent, collective bargaining has always been a part of our ethos in the American way of doing things. It's not a new thing.
For nurses who are experiencing these things and they find themselves having to go on strike, if they don't feel like they're getting the support within their organization, within their hospital, what can they do?
So, nurses have always had an interesting, challenge of collecting themselves and being supportive. We have too many divisions, from our educational levels to, how we're put against each other. But we're still one profession. So they need to turn to each other. We got to support ourselves. But we also have our nursing professional organizations. You can get support other places. I'll give you a good example. In New York City, we have a couple of NBNA chapters, and we had members that were out on strike, and we supported them. We heard them. We have our annual legislative day that we do. A lot of those issues overlapped in terms of the nursing workforce, access to safe work environments, same issues. So I think they would see the support in other places and in other professional nursing organizations, because you got to find that support somewhere. And then even during the strike, there was, a very intentional effort to raise funds to support people, because, when they cut off those nurses' health insurance, which is a really dirty, underhanded tactic, this is life and things still do happen. So there was that effort that I think people actually saw. And I hope people did feel supported. And it's not the first time. This is going to happen again because we haven't fixed problems.
This year's theme for Nurses Week is the power of the nurse.
Yes.
What does it mean for nurses to step into their power?
Mm-hmm. Authenticity in being unapologetically a nurse. You know, we are the largest segment of the healthcare workforce, the most trusted. But as it's been said, we're not the most respected. And respect starts at home, because I don't think we always respect ourselves. Because, you know, if we did, there would be no question as to what we could do in terms of the coalitions that we should be able to build. I'll look at our medical colleagues in the AMA. What the AMA wants, the AMA gets. AMA doesn't have that same force. You know, we don't speak with one collective voice on most issues. We segment ourselves. But if you're really about power, power is about representation. If we stood 10 toes down with the full force of the millions of nurses that are in this country, let alone around the world, and we stop letting false divisions divide us, that's power. And then realizing that you can leverage it for other things. I tell nurses all the time, you want to really leverage your power and your influence as a nurse? Do what Representative Lauren Underwood did, run for office. Do what Edie Bernice Johnson, the very first nurse elected to Congress. And a lot of people don't know, she was a Black woman from the state of Texas, in a profession in which Black women are not the majority. But the very first nurse ever elected to Congress, a Black woman. And, you know, again, in NBNA, we just started a health policy training program named in her honor to help people to train how to be good advocates. That's stepping into your power. That's leveraging the relationship that comes along with the fact that you are a nurse. And we make really good candidates. Now, that being said, I'm not going to run for office because I think there's other things that I also can do. But for those who have aspirations, think about it.